and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Dr. George R. Smith Jr. Dr. George R. Smith Jr. is a public health professional and educator with a strong commitment to addressing health disparities and inequalities, particularly in underserved communities. He has experience over 25 years in public health, community engagement, social services, and non-for-profit management. He currently serves as an assistant professor of public health and undergraduate program coordinator at Chicago State University. He's also a program chair for the Black Caucus of Health Workers with the American Public Health Association. He is dedicated to increasing the representation of underrepresented minorities in health science professionals and making a positive difference in the field of public health and community engagement. Welcome, Dr. Smith.
Thank you. Good morning.
Can you tell us more about your role as program coordinator for the Black Caucus of Health Workers and how it contributes to the mission of the American Public Health Association?
Yeah, so I've been the program planner roughly since 2016. And as a program planner, my goal is to make sure that we have sessions or scientific sessions that meet the needs of individuals, particularly those who identify as Black or African American. So we seek out, students, we seek out public health practitioners, as well as those in academia that are working with African Americans to cover whether chronic disease, infectious disease, behavioral health, women's health, men's health, and maternal child health, just to name a few. And so realizing when we talk about public health is very broad based. And so we try to find, again, informational sessions or get research or seek out presentations that cover a broad spectrum. And again, whether it's infectious disease or chronic disease, because we know that the world is changing. Think about it. In 2019, we were in Philadelphia. Lo and behold, 2020, COVID came arise and we did not meet. So just looking at ways to see how we can find information that we can disseminate that is credible, definitely credible, that we can get out about African Americans and their experiences in the United States.
Definitely very important. Now, talking about your research focuses on different aspects like impact of spirituality and religious belief on health behaviors and outcomes, ethical issues related to research involving African Americans, and psychosocial determinants of health of infant mortality among African Americans. Can you share some insight from this research and their implications for public health?
Sure, definitely. I'll start, I know this sounds like a lot, but I'll definitely start with the one in regards to looking at spirituality and religious beliefs. Many African Americans identify with some form of religion, whether it's Christianity, it could be Islam or Judaism. And we know that when we talk about social determinants of health, religion plays a very important part. We have to look at, for example, people's beliefs. If you look at someone who's a 7-day Adventist and you look at their dietary restrictions or their dietary preferences, what is it? Many are vegetarians, so they eat a diet that's very heavy and plant-based. We know that having a strong plant-based diet helps what? To lower rates of cardiovascular disease, lower rates of heart disease. We also know, particularly looking at religiosity or spiritual beliefs, that plays a very important part in looking at, say, for example, reproductive health. And so many individuals, based upon their religious belief, may think that family planning may be appropriate, some may not. So again, we're looking at how a person can have a healthy and productive life. We can't ignore issues of religion. Some people don't practice religion and some people do. And for those who do, we should pay attention to that to make sure how we as public health can partner.
Great. So religion really plays an important role in public health.
It does. And so one thing that, again, I like to share with that, not to spend a lot of time, but we can't ignore that. We have to be mindful of religion. We also have to be mindful of culture. We have to be mindful of gender roles. Not saying that they're right nor wrong, but we have to acknowledge those things.
Great. Now we are at APHA 2023. What are you expecting to take away from these gatherings?
I am here. I like to come every year because this is an opportunity for me to learn more what my colleagues are doing. But I think one of my highlights is that I get a chance to interact with students. I remember I was an early professional when I started coming in 1999, and it's just to interact with people, to learn more about public health. Sometimes when we go back home, we're in our silos. We just focus on what's within our little area, but coming here, we get an opportunity to see what's going on, whether it's, at a state level, we get to see it at a regional level, we get to see it at the country level, but also global.
Wonderful. Now, can you share some of the achievements and challenges that the Black Caucus is experiencing?
I would say our achievement is this is our 55th year, so 55 years for the Black Caucus of Health Workers and 50 years for the Latino Caucus. We have a strong history of collaboration, as shared yesterday when the Latino Caucus was being founded in 1973. The Black Caucus of Health Workers was the caucus who said, we're going to support you. And so I think over the years, like many organizations, just trying to get people involved and stay engaged. And so we're looking to grow like the Latino Caucus and to do better and to do more.
Wonderful. Now you talk about religious belief and public health. How is that received by the younger generation?
Well, and that's something you bring when we talk about the younger generation, millennial and Gen Z. Some of the recent data, I don't have it with me, but just looking at that, they are not practicing religion at the same rate that baby boomers and Gen X are, or the dreamers. And so therefore, we have to be very mindful of that. When I'm looking at particularly engaging African Americans, a lot of time the African American church comes up, which is true because it has played an integral role of African Americans in the United States, particularly with civil rights and gaining, things like that. However, there is no one catch-all. So you just can't say, for example, if I want to work with African Americans, we're just going to go to an African American church and that's going to solve everything. No, it does not work like that. So you have to think outside of the box. For example, you may, particularly when trying to engage African American men, if we go to any particular African American church, it's roughly, if you look at the attendance, greater than 70% will be women. So therefore, if you want to do outreach to African American men, maybe going to a church may not be the option. It can be the preferential option would be not an African American church, but it could be one of many options that you could do to engage African American men.
Thank you for sharing that. Now, as a public health educator, what are some of the key messages you aim to convey to your students about the importance of public health and community engagement?
So the one thing that I try to tell my students, and I know this is going to sound a little quirky, and I'm just going to be honest, I tell them to read. So you have to read. That's number one. Number two, I really try to have conversations about enhancing their critical thinking skills. And I always tell my students, check the source. Always check your data. Because sometimes, when we look at primary data, we know we get it ourselves. But when it comes to secondary data, and I've learned recently tertiary data, double check the source. Look and see what the information is. Doesn't mean that you discount it, but you should always check the accuracy, the validity, and the reliability of the data to make sure that you are getting the most accurate information, because we don't want to perpetrate myths. If you look at the history of science, particularly those of us who are of color, if you look at science 100 years ago or even 150 years ago, we were disadvantaged. And believe it or not, there was a psychological disease, I forgot the name of it, that was placed on African Americans who wanted to escape from slavery. They had a diagnosis. It was a mental illness diagnosis that you want to be free. And so that's why we have to be very mindful and look at the science and look at the source and those types of things. So again, I think, nobody gets it right, but always pay attention to your sources.
Pay attention to your sources, reading. Thank you for your advice. Thank you for sharing with us today, Dr. Smith.
Thank you so much for the invitation, and happy 50 years.
Thank you.